Clinical Ophthalmology with Dr. Imran Ahmed. We will discuss the epiretinal membrane and its removal. Basically, epiretinal membrane is a transparent fibrocellular membrane, not a fibrovascular membrane, over the surface of the macula or over the surface of the retina. Posterior vitreous detachment is a prerequisite for the idiopathic epiretinal membrane. When there is posterior vitreous detachment, there is some trauma to the internal limiting membrane and also some remnants of the cortical vitreous remains over there that provide a space for the proliferation of the cells. The microglial cells and hyelocytes proliferate at the vitreoretinal surface interface, leading to the formation of the epiretinal membrane. Epiretinal membrane, the idiopathic one, is age related, and that's the reason that at the age of about 50 years, only 2% of the patient develop epiretinal membrane, whereas at the age of 70 years, about 20% of the patients develop epiretinal membranes. There can be secondary epiretinal membrane, and the causes for the secondary epiretinal membrane are the vascular occlusion, uveitis, trauma, or lasers to the retina. Sometimes even prophylactic laser can lead to the ERM formation. Retinal surgeries after siliconal or gas can lead to the ERM formation. And sometimes if the posterior cortical vitreous is not removed completely during vitrectomy, specifically in diabetic patient, will lead to the formation of epiretinal membranes. Usually the patient is complaining of distortion of the vision along with the metamorphopsia. That is the primary complaint of the patient. If the epiretinal membrane is smaller one, it causes premacular fibrosis called cellophane maculopathy. And if it becomes thicker, and then it leads to a macular pucker formation. And at that stage, it usually there is distortion of the retinal surface, and also there is distortion of the architecture of the retinal vessels. No treatment is usually needed if the vision is good and stable and the patient is comfortable with these signs. But if the symptoms of the patient is bothersome, the patient cannot tolerate these symptoms, there is deterioration of the vision associated with macular issues like macular edema, and the epiretinal membrane is thickened, and the treatment is surgery like the pars plana vitrectomy and removal of the epiretinal membrane. The epiretinal membrane is attached to the retina with the foot plates, and we need to peel the epiretinal membrane from the surface of the retina, and that is through the pars plana vitrectomy and staining of the epiretinal membrane, and then it's peeling from the surface of the retina. Sometimes it extends outside the vascular arcade. It usually not needed to remove it from outside the arcade, but it must be removed from the premacular region. This is the pars plana vitrectomy surgery for the epiretinal membrane removal. The patient is phakic, so I have placed trocar 4 mm from the limbus. Anterior vitrectomy is completed. Then the core vitrectomy is done. And as the patient is phakic, so one should not cross the midline in order to avoid the lens touch. Triamcinolone I inject in almost every patient. Peripheral vitrectomy is completed as much as possible. Then ear fluid exchange is done, and then the dye is injected to stain the epiretinal membrane. The epiretinal membrane is now stained, so to remove the epiretinal membrane, usually starting from the periphery towards the center, as I already mentioned that the epiretinal membrane is sometimes having strong foot plates, stronger attachments with the surface of the retina. Maximum try should be done to avoid any retinal touch. And slowly, the whole epiretinal membrane can be removed from the surface of the macula. And at the end, the eyes filled with air. Thank you very much.